You know, currently for gastric or gastroesophageal junction adenocarcinoma, it's recommended for any clinician to know the status of some biomarkers up front when you have to decide about some therapy in advanced disease. And currently we have basically two main biomarkers, the HER2 and the PD-L1, that can change completely our therapeutic approach. So both can be negative or positive, and there are some assays, some score systems validated to realize that. And for HER2 positive, we have chemotherapy plus Trastuzumab, and now also plus Pembrolizumab, as presented at this meeting. The very good result confirmed significant in terms of overall survival regarding the study Keynote 8-11. If HER2 is negative, we can check PD-L1. So PD-L1 positive or negative basically means that you should check the CPS score. If the CPS score is more or equal than 1, this is positive. And there are some drugs approved on this basis. Pembrolizumab is approved for PD-L1 positive more or equal than 1. Nivolumab plus chemo is approved on the basis of CPS more or equal than 5. So it's crucial to know this upfront, as if PD-L1 is negative, and this represents the minority of cases, you should go ahead with the chemo only. If PD-L1 is positive, chemo plus immunotherapy. But currently we have also to be aware that we have some very interesting emerging biomarkers. First of all, the claudin 18.2, that is a very good biomarker, as we have already 2 phase 3 positive trials, the Spotlight and the Glow, that demonstrated the advantage in terms of overall survival of Zolbetuximab, that is an anti-claudin drug, compared with plus chemo, compared with chemo. So having this option now, ESMO guidelines, the latest update of the ESMO Living Guidelines reported that if you have the opportunity to check in your laboratory the claudin 18.2, you should do this, as of course Zolbetuximab is much probable that is about to be approved on this basis. Therefore, it should be known upfront. And another important point that I would like to remark, that these biomarkers is better to be known as soon as possible. So when you have the diagnosis, you should know this. After these two biomarkers, it's also important to know the status of MMR, MSI, as of course also this is a very important predictive biomarker. In fact, this is the most predictive biomarker in gastric cancer, but this is not a biomarker for decision making as first line, but in a further line, if you have the positivity of this, you can propose to your patient Pembrolizumab.